in progress, but also there'll be a lot of people that are going to watch the recording of this too. So that would be great. So terrific. Well, let's go ahead and get started. Thank you for joining us today. This is the launch of the CCIH Faith Consortium for Climate Resilient Health. And if you haven't already done so, feel free to introduce yourself in the chat box. As we get ready, and before I start my intro remarks, I just want to point out that we're using Wordly artificial intelligence for translation. Wordly provides written translation and audio interpretation. Audio interpretation information is available on the screen right now. Step 1, listen to the interpretation. To listen to the interpretation, we recommend opening this QR code on your phone. When the Wordly site opens, if you're asked to enter a session ID, it is listed there. You'll see it, the NCQC5963 and the passcode 183474. Step 2, choose your language, such as French. And then step 3, you can turn down the volume of the audio of the original language in Zoom so that you can hear your desired interpretation. You can also just enter the link in a browser to access the translation if you want to read the translation at the same time and not hear it through audio. It may be difficult to reduce the sound. You can listen to this link as well, but it may be difficult to reduce the sound in Zoom. So leave that to you. So those are your choices there. Great. So good morning, good afternoon, and good evening. Thank you very much for joining today from different parts of the world. It is our pleasure to welcome you all for the launch of CCIH's Faith Consortium for Climate Resilient Health. I am Doug Fountain, and I just lost my notes. So let me get them back up here. I should be able to introduce myself without notes, don't you think? I'm Doug Fountain. I'm Executive Director of Christian Connections for International Health based in the Washington, D.C. area. For those of you who are new to us, CCIH is a global network of over 100 Christian organizations, as well as secular and interfaith partners committed to advancing health and wholeness. CCIH members work in over 90 countries globally. These members include non-governmental organizations, church networks, Christian health associations, volunteer and product donation agencies, and other support organizations. So that is a bit about CCIH. Now, to our topic today. I'm really excited to be able to start off today. Let me frame this with a conversation that happened last year at our biennial global conference in Washington, D.C. We had a special session on readiness for climate change. Ann Peterson led that session, and some of you on this launch event were part of that conversation. Ann started with the scenario. Imagine sudden increases in rainfall, placing stress on a local dam, threatening communities downstream. You have days, but perhaps only hours to act. We broke into groups to discuss how can we prepare communities and health facilities? What do we wish had been in place before that? And what is our role and voice as Christians in this as well? Since then, we've seen some really frightening headlines. First, in September, that conference was in June. In September, Tropical Storm Daniel overwhelmed Libya's Derna Dam, causing 4,000 immediate deaths and leaving 10,000 people missing in the aftermath. In October, heavy rains overwhelmed Ghana's Akosombo Dam, displacing 26,000 people and causing water pollution and waterborne disease. Also in October, heavy rains in northeast India caused the South Lonak Lake to breach its banks, overwhelming a dam that was downstream from that and sending a 20-foot tall wall of water to the communities below. And then just this year in April and May, just 2 months ago, Kenya's epic rains flooded communities, damaging or closing 64 health facilities in 12 counties. Floods like these, along with droughts, excess heat, and increased air pollution, are just some of the risks that result from climate change that will worsen health if we are not prepared. It is truly sad to me that political debate over the causes of climate change still slow our global capacity to respond. I was at a meeting a few months ago where some leaders of Christian organizations were still uneasy about whether it's okay to talk about climate change. Really? Let's get on with helping our communities to prepare. So we started the process a few years ago, and we can show a timeline of what CCIH has been through. So if we would go to that, please. The timeline. There we go. In 2022, CCIH did a landscape analysis of its membership and their views and involvement in climate and health. In 2023, CCIH started to pull together interested partners to set goals and form a consortium. We assembled resources and started meeting, and we framed out the action statement that we are sharing today. In 2024, right now, we're officially launching this consortium and releasing our action paper. And then moving on from 2025, what we want to do is create a movement, or I like to think of it as a series of movements, groups, clusters of action, of activity that are happening that are very local, that can help communities and health facilities prepare. Now, several partners stepped forward to help us be part of the new consortium and to focus CCIH's advocacy and programs. And I think we have a list of those members. So the initial members of this Faith Consortium for Climate Resilient Health include World Relief, World Renew, Providence Health, their global health team, Mennonite Central Committee, Kupenda for the Children, the Methodist Church of Togo, and Chorus International. We are very excited to begin work with these partners that span health services, international NGOs, local church, local operations. It's the right group of people to start with. We created an action paper that we are officially releasing today, and we'll give you the links to this as we proceed today. We'll create many ways for members and other partners to engage in coming weeks and months and years. To get us going, though, we're going to kick off with some presentations from 3 panelists and then share the action statement and our road forward. So I'm going to set up now for with the introductions for 3 different presenters, and then we're going to go and listen to each of them. So the first that we're going to hear from, we can show his bio now, is Bishop Godson Lawson, who presides over the Methodist Church of Togo. He's the vice president of the All-Africa Conference of Churches and the African Methodist Council, and is interim president of the Fellowship of Churches and Councils in West Africa. After that, we're going to hear from Elizabeth Pleuss, who is the deputy division chief for maternal and newborn health at the U.S. Agency for International Development's Global Health Bureau. She supports the Bureau's engagement on climate change. She has championed cross-sectoral work in environmental, social, and economic determinants of health, focusing on tuberculosis, innovations in maternal and child health, health resilience, and supply chains. And then the third person we're going to hear from is Martina Dhliwayo, who is the Climate and Health Manager at Seed Global Health. That is an international NGO based in Boston, which supports local projects in Malawi, Sierra Leone, Uganda, and Zambia. What's really exciting about Seed Global Health is that they are working also at the local stage, but also at the global stage. Martina influenced the recent COP28 meeting on climate change, and her CEO, Vanessa Carey, is the WHO Special Envoy for Climate and Health. So we're very excited to hear from all 3 of these panelists. After that, we're going to hear a few videos, and then we'll turn to the action statement and what CCIH and the consortium is going to do next. So first off, I welcome Bishop Godson. Please, you're welcome. Feel free to share your remarks. Thank you. There we go. And you're muted.
Okay, thank you
There
very much. Yeah, I think many biblical theologians in their readings of the events of the Bible trace climate change back to the flood in the Bible with Noah. For some theologians, after the flood, certain species disappeared and the world gradually entered a constant and irreversible process of climate change. So theologically, we think that climate change started from the flood when Noah was one of the most important figures. But in Togo, for example, the effects of climate change are becoming more and more visible. Togo recorded 60 urban and rural floods between 1925 and 1992. And this flood caused material damage and loss of human life. For instance, 34,000 people were displaced, and also 102 bridges were broken. And secondly, we are facing the reality of droughts. In the past, it is in the northern part of the country, but today we are witnessing drought situation even in the southern part of Togo, and also famine and the degradation of the land, and also the loss of the biodiversity. We have also, especially during this year, between February and March, we have the height heat. They are essentially characterized by high temperature, and this temperature in the months of February, March, and even April exceeded 35 degrees centigrade. We have also strong winds. Because of the geographical location of Togo, we can have about 115 kilometers by hour. And also the shift of our season. And the shift of seasons has become a recurring phenomenon in Togo over the last 3 decades. And finally, the poor distribution of rain, and also the feeble production in terms of agriculture. And some of the risks that we are facing, there are 3 major risks. The first one is the increase in the morbidity and mortality rates linked to malaria. And the second one is the increase of the morbidity and mortality rates linked to respiratory infections. And the third one is the risk of increased morbidity and mortality rates linked to the bacterial meningitis. And as far as the southern part is concerned, we have a place called Aneho, which is an historical place. And in 1974, the government has decided to make this place, which is on the coastal region, a tourist area and a seaside resort. But today, 50 years later, this site has not only disappeared from the landscape of the country, but its inhabitants have also become environmental and climate refugees. So coastal erosion has been accelerated due to the climate change in the country. And experts used to say that the sea erodes 7 to 15 meters every year from the coastal region. And some of these climate refugees are now squatting some of the building, especially the building of the Methodist Church, which is located not very far from the place. And they told me last time when I met them that everything about our way of life is being called into question, because the majority of them are fishermen, so they can no longer go for fish. And last Saturday, we met and with the women in the region, and we made some decision and resolution. The first decision is to continue to resuscitate some of the trees which disappeared in the region, like the sea grape, and also to continue to plant coconut trees, and also to work on the mangrove so that the mangrove can help them to have fishes in the lake and in the rivers. And fortunately, we had a support from the city council mayor, who promised that he will put his team aside to help us to achieve what we are doing in terms of mitigating the impact and effect of climate change in Aneho. So that's what I would like to share with you, because I don't want to be long. Thank you very much.
Well, thank you. Thank you very much, Bishop. I really appreciate your perspective on that, and starting with the historical and biblical precedent for this, but making it grounded in a very real terms and what your communities and populations are dealing with. We appreciate your sharing about that, and your voice of leadership as a leader in places affected by climate change. So thank you for that. We do appreciate that. We're going to turn now to Elizabeth Pleuss with USAID. So Elizabeth, I think over to you now.
Thank you very much. It's a pleasure to be here. Thank you all for the organizers and the other speakers and participants. As I've been introduced, my name's Elizabeth. I'm with the Global Health Bureau. Many of you are quite familiar with USAID's work. We partner with over 100 countries across a variety of development-related sectors. We also have a long history of partnering with faith-based organizations and religious communities that work to advance sustainable development and humanitarian outcomes. And as you all know quite well, faith-based communities serve some of the most vulnerable populations in the world and have long been at the front lines on working on issues like climate and health. And they really can hold special positions of trust and have the unique ability to draw from wide networks to convene important conversations, bring people together, and inspire action. So it truly is exciting and heartening to see a group of faith-based organizations come together to tackle the very serious challenge that climate poses to health. Of course, from its early days, USAID has had a strong focus on health, and our work to improve life expectancy takes many different shapes, ranging from helping ensure that mothers give birth safely, delivering life-saving vaccines, treating childhood illnesses, increasing access to HIV treatment and prevention, and slowing the spread of infectious diseases, including malaria and tuberculosis. However, in the past several years, our administrator has occasionally stated that our entire agency is now a climate agency. Next slide, please. And that is true in some ways, because the increasing frequency and severity of climate crises around the world makes our work that much more challenging. Climate disasters disproportionately impact low and middle income countries. And you can see here, this map shows the countries most vulnerable to the impacts of climate change, with the darker colors indicating more vulnerability. And you can see that the areas of greater vulnerability really map quite closely to the areas that USAID partners in. These countries already experience high disease burden, often weak health systems, and sometimes fragile and conflict contexts, which lead to even higher vulnerability and a lower ability to cope. We also know, in addition to extreme weather events, climate change is driving global hunger, triggering humanitarian needs, and increasing food security, all of which intersect with health. We also know that climate change has triggered displacement of over 8.7 million people in 88 countries in 2022. And this displacement, combined with some of the direct impacts of extreme weather events themselves, can disrupt access to essential health services, as well as expose individuals to new health threats. And we know that this all points to the fact that climate change could really reverse decades of public health progress. Next slide, please. So USAID's most recent climate strategy was released in 2022. And this is different than previous strategies in that this is an all-of-agency strategy, meaning that it's really being pulled out of the environment sector. We're integrating climate change considerations across all areas that we work, including health. And this is focused, it's organized in primarily 3 different strategic objectives, and I'll just walk quickly through them. One is taking direct action, doing what we can now, covering, reducing emissions, the mitigation component at the top, and then building resilience, really looking at climate adaptation, but also acknowledging that our adaptation efforts can build resilience to other shocks and stressors. And we've seen that, for example, some of our programming intended to build resilience to extreme weather events have also benefited COVID response efforts, for example. We're also, one of the key areas of work is trying to mobilize finance, making sure that we can get financing available to the communities that need it, acknowledging that donor funding is insufficient. So really looking for other organizations, including the private sector, to partner with. And we're really also focused on working with local communities, including Indigenous people and other vulnerable groups, to ensure that their voices are heard and they're not just recipients of activities we do, but that they are voices for change and agents of change in their own communities. As we're doing that immediate direct action, we're also working on the right side, the drive systems change components, to really transform systems, to make sure that systems, markets are more sustainable, that the governance systems are in place to ensure a more sustainable future for all. And then that third part at the bottom, called do our part, this is a bit new for USAID. This is really reflecting on our own internal operations and how to make them more sustainable and to reduce our impact on the environment, including climate change. You can see in the center, there are also several principles that cut across all of our work in this step. And I'd really like to draw your attention to that first one, locally led development. We know that grounding climate change adaptation in local contexts and using local knowledge, including Indigenous knowledge, is critical. And not only do the geographic and climatic factors vary by location, but the specific vulnerabilities that communities and specific populations within those communities face can be very unique. Or I like as the statement that will be previewed for us later, as it puts it, climate change is having both broad and intensely specific impacts. So it really is beneficial to work with local communities and those organizations and institutions within them to address those intensely specific impacts that climate change can have. Next slide, please. Much of our work at the nexus of climate and health does revolve around climate adaptation and especially health resilience. And we define that as the ability of people, households, communities, countries, and systems to mitigate, adapt to, and recover from shocks and stresses in a manner that reduces acute and chronic vulnerability and facilitates equitable health outcomes. So I'll give you just a few examples of what this work looks like on the ground. One area of work we're doing is developing and improving early warning systems, both for extreme weather events, but also for health-specific threats. And this includes integrating climate data and early warning systems data into routine information systems and decision-making. So that's pulling from both climate and weather data alongside the epidemiological data to identify shifts in climate-sensitive vector-borne diseases, such as malaria, to adjust our programming and to ensure that it aligns with changes in the timing and duration of malaria transmission seasons so that communities have access to the right tools at the right time to prevent and treat malaria. Another example of our early warning systems work is building on the FuseNet platform. Many of you might be familiar with FuseNet, or the Famine Early Warning Systems Network, which for decades has tracked and provided early warning for food insecurity and famine. And we now have some pilot activities that uses that platform focused on early warning for health. In Mozambique, we're focused on malaria, and in Somalia, we're using it for measles. So stay tuned to hear how those pilot efforts turn out. We also work broadly to build the resilience of individuals, families, and communities and health systems. And this includes building the resilience capacities and also social capital for people and communities, as well as health system strengthening activities that can support increased flexibility, preparedness, and responsive systems, also to inform better decision-making. And one example of working with the health systems is an activity that we've done in the Philippines, focused on the barangay level, similar to a county level. The barangay health emergency response teams are a small group, usually 3 or 4 people, who are trained in health emergency response. And they are ready and prepared to assist with responding after or during climate change disasters or other disease outbreaks. And they can provide last mile health service delivery, even when transportation options are disrupted due to some of the many typhoons they experience or other extreme weather events. And this is one of those examples where they were also tapped to support the COVID response in the early days of that. Next slide, please. And I'm sorry I don't have more time to walk through a few additional examples, but I really we'll look forward to hearing more during the conversation. And I did want to leave you with a few of these resources. I'll also paste them in the chat. But one is the climate strategy. Prepare is the President's emergency response for the emergency response for adaptation and resilience. Sorry about that. And this is a US government-wide effort to support countries on climate adaptation. This next Climate Links is a great portal for a variety of resources that you might find familiar. And again, a couple of other, including at the bottom, which isn't specific to climate change, but our localization progress report. I've mentioned that working with local communities is a priority for USAID. So I thought that might be of interest as well. But I will leave it there. I look forward to more questions and conversation. Thank you.
We're grateful for your words and your perspective on this. And I have to say, Elizabeth, starting with motivational words for the role and value of the faith communities was great, and I really appreciate that. And then backing that up with excellent technical leadership and terrific resources. Thank you. Thank you for the work that you do. We appreciate that. And now turning also to a team that is working simultaneously at the policy, but also especially at the local level. I'm pleased to welcome Martina to speak with us about the work that Seed Global Health is doing. So Martina, over to you now, please. Thank you.
Good day to everyone. My name is Martina Dhliwayo. I'm currently in Dhliwayo here in Zimbabwe. As Doug mentioned earlier, I work for Seed Global Health as the Climate and Health Policy Manager. I'm really excited to be here, and thank you so much for your kind invitation to this launch. Would you mind moving on to the next slide? So I just wanted to give you a brief about Seed Global Health. We're an organization that is strongly focused on health workers. Health workers are one of the most key components and most important parts of any health system. This is especially in the light of all the issues that Elizabeth and the Bishop were sharing, that the places where we are all working are being affected by climate change, pandemics, rising diseases of burdens of disease, and so on. And we need equipped and capacitated health workers much more than we've ever done before, which is what Seed Global Health works on. Next slide, please. So we are based in Boston, and we are headed by our CEO, Vanessa Carey, who is the Climate and Health Special Envoy for Health. So we work in 4 countries: Malawi, Sierra Leone, Uganda, and Zambia. So we really are working towards improving quality healthcare, like USAID and many other organizations out there, and your consortium. So we are here to build the health work for the future, a capacitated health workforce, and we are also advocating for investment at both the national and the international level. We partner with local institutions such as hospitals, clinics, academia, and obviously some of those hospitals are also Christian and faith-based organizations. Next slide, please. So in our bid to ensure that we are educating the right people and improving health system, we focus on reproductive, maternal, and newborn health, primary health care, and emergency care. Next slide, please. And in addition to this, one of our newest areas of focus is climate change and health. We are there to educate, train, and mentor health workers so that they are better able to respond to the challenges that climate and health has given us as a world. We are trying to do this by integrating this into curriculum, into training, mentoring, and also just ensuring that the public in general also knows what's going on as we try and build resilience amongst the communities that we work in. Next slide, please. So we are all facing a challenge, and like Elizabeth, I'm also just going to show you some statistics about the dire situation that we are all facing as we are in this world that is direly affected by climate change, especially in terms of the health impacts. Next slide, please. So we've already passed the 1.5 degree target that we had set apart. We are now at 2.7 degrees above the pre-industrial era temperatures. This, according to the World Economic Forum, means that an additional 14.5 million people will die, and this would damage our economies by 12.5 trillion, including a lot of money spent on responding to the health challenges caused by by climate change. We, as Elizabeth has already mentioned, where there's increasing frequency of weather events such as droughts, flooding, all over the world, and heat waves. All of those things will continue to increase in incidence. Many people will be facing hunger. More than 80 million people will be at risk of hunger all over the world, mainly in Africa, Asia, and Central America. The climate change will not just lead to death, it will also lead to disability. People will be injured in these severe weather events. They will suffer from diseases, and in particular, as life goes on, the mental health challenges that people suffer from as a result of things like droughts, flooding, hunger will continue to affect many people, and all of this will continue to strain the health systems that so many of us rely on. Next slide, please. What we need as we do this is we need a collaborative solution. Not one person, not one organization, not one donor can save this, can save us all, can address this issue. Next slide, please. Faith-based organizations are key actors. In a past life, at the beginning of my working career, I worked for the Baptist Union of Zimbabwe and the Central Baptist Church, working on community-focused programs addressing the cholera outbreak that was taking place in 2010. And during that time, I have learned what community and faith-based organization can do, the understanding you have of the local context, the understanding you have of how can you solve this program, how you understand the information that is going on. And from that perspective, I see how we can all be part of this problem, from just being a problem identifier onto a people where we implement solutions together. So I think that it's, in addition to that, there are other factors that we really need to work on, which is to advocate for governments to focus on adaptation and resilience. We need to educate health workers, which is something that See Global Health is doing. And we need to work across multiple sectors. Climate and health is not just a health issue, it's a water and sanitation issue, it's a agriculture issue, it's hunger, malnutrition, all of these, we need to work together. And we also need funding. We need money to do what we need to do to protect and make our communities more resilient. Next slide, please. So this text, I think it's you need to press it again. Oh, okay, sorry. So when I look at the consortium and the work that you are planning together jointly, I see a few things that I am in deep awe for. The ambitious targets you have, the fact that this is about catalyzing change, that you're focusing on collaborative situation and you're using evidence, for example, the mapping of the Christian health partners, and you're focusing on communities. When I look at that and the alignment with the work that Seed Global Health is doing and other organizations are doing, I see that all of us have a part to play in solving this problem for climate and health. And I wanted to just commend you on this important work, your focus on local communities and your focus on really trying to solve a problem and just not looking at it. I just wanted to thank you for this opportunity. That's just the end of my talk. Thank you.
Martina, thank you so much. I really appreciate your voice and perspective on this, but especially those words where we are moving beyond being a people that identifies problems to being a people that implement solutions together. When we spoke, what I really appreciated was you also work at the policy level, but you really value that inherently local action. And that's really what this is going to take is supporting those movements on the ground. And so we're grateful for what Seed Global Health is doing, and thank you for being part of this today. Grateful. Okay, let's move on now. We're not going to take time for questions and answers in this at this moment, but if you have a question, please put it into the chat. We'll be capturing those, and as we get towards the end of the time together, we'll take a look at those. But for now, I think we have 2 videos we're going to share from our partner World Relief. So we would like to see those now. So please.
My name is Dr. William, medical officer working for World Relief. We are located right now in Rukona County, Unity State, standing next to a riverside. Rukona County is affected by the climate change, devastating the situation in a few years back, and still as a result of them. This is not an old fashioned river, but now water is collected in this area, making it a barrier to reach out for some of the villages and the locations that our services are reaching. We have nutrition and health services running on within this county. Some are using far places like in Mob, like in Norbur, like in Tong. Those areas are not easy to be reached because of this water. This water is not a river, as I said, and it's coming from the riverside to my right side. We have this water for now 3 to 4 years, and it's affecting the services that we are offering in very light way. This water is affecting the referral system from the village to the center, and it's also become a barrier for accessibility to those villages. This water also having an effect very much in the displacement of people from where they are living, because all the lowland areas, all of them are occupied by a kind of water like this one.
Great. Yeah, I think we'll see the second video.
Libwanje ndiri bwino ine ndine Tonge Phiri ndikuchokera ku Relief Malawi, mlangizi wa Climate Just Communities. Tsiku la lero timafuna ticheze nanu za momwe kusintha kwa nyengo kumakhudzira banja lanu komanso umoyo wanu. Mukulola kuti ticheze nanu?
Ndikuvomera kuti ticheze nanu.
Okay, zikomo kwambiri. Mungatifotokozerewo kuti kodi kusintha kwa nyengo kumakhudza bwanji banja lanu komanso pakhomo panu komanso umoyo wanu?
Kusintha kwa nyengo kumandikhudza banja langa komanso umoyo wanga komanso ngati mudzi mwathu muno. Kumatikhudza ndikuti matenda amafika pafupi komanso banja silikhala ukhondo komanso maphunziro ananga amakhala operewera. Zimene zimakhudza ndi zambiri, njala, ilala ya komanso chilengedwe pakhomo chimakhala palibe, komanso molima kusowa chifukwa cha kusefukira kwa madzi, kusintha kwa nyengo.
Okay, zikomo kwambiri. nanga inuyo chimene mumalakalaka kuti munakakhala nacho kandi pa khomo panu kandi pa umoyo wanu choti chinakathandizira kuti kuchepesa mulingo wa zimene zimabwera ndi kusintha kwa nyengo.
Chimene ndimalakalaka kuti ndidakhala nacho kuti mwina pobwera za ngozi kugwa dzidzidzi indipezeko ndi bwino osati ipitirizo kwambiri muyeso yayi. Ndimalakalaka ndidakhala ndi zipangizo zokhudzana ndi nyumba yanga imene ndamanga, komanso ndikhala ndi zipangizo zokhudzana ndi ulimi kuti mwina kutakhala kuti ndalimako timbewu tinata tosachedwa kudya kapena tiwapirira kuchilala kuti umoyo wanga mwina ukhonzosintha kuti pofika ngozi zinazo zadzidzidzizo ndikhala moti pena pakenda penteketserako. Ndi zimene ndimafuna umoyo wanga, ndimafuna zimenezo.
Zikomo kwambiri, ndathokoza kuti munalola kuti tichezeko. Zikomo.
The need is evident and compelling. And when you see the videos, we're grateful to World Relief for sharing these two videos, one showing the situation in South Sudan, the other in Malawi. And the personal toil, the personal cost is enormous. And you can see the concern on that gentleman's face, facing an uncertain future. So friends, as faith-based partners, we have a lot to do to support. For CCIH, our focus will be on health and how do we strengthen, preserve, and promote health for populations affected by climate change. With that in mind, it's now time to turn to the actual work of this consortium. So we're going to next hear from Ann Castleton, Dr. Ann Castleton, who's advised our startup work. Ann helped draft the action statement that we're launching today, and Dr. Castleton has over 20 years of experience working on disaster risk. Has a number of years. I don't want to say how many years of experience, Ann, you've got, but work in over 20 countries working on disaster risk reduction and climate change. Recently retired from the city of Portland in Oregon, where she led emergency planning and previously directed Mercy Corps and other NGOs work in disaster risk reduction. So Ann, we'll be hearing from you. I'll say the second bio, if I can share that, and then we'll go on to that. So after Ann, we're going to hear from Carolyn O'Brien, who's CCIH's program advisor, who manages CCIH's growing portfolio of projects in health system strengthening, Christian health asset mapping, and now this Faith Consortium for Climate Resilient Health. In fact, I will say publicly that this effort is in no small part a reflection of Carolyn's commitment and persistence to see this come together. So we're going to be excited to hear from both Ann and then Carolyn. So Ann, over to you.
Thank you. I just want to say that it has been such a pleasure to work with CCIH, that in addition to being strong colleagues and expert at what they do, they are so nice to work with. So it's been a great pleasure for me. This statement that we developed with the consortium, I think Carolyn's going to put a link to it. I just would like to talk a little bit about the background. Can you go to the next slide? As the speakers have already mentioned, and as we say in the statement, climate change has both a regionally broad and a locally specific impact. This slide talks about 5 of the health impacts, and I think the speakers have all addressed a number of these. I just want to point out that I think the world is coming to accept and acknowledge that plants, animals, and people, our health is interrelated. And when one of them is not healthy, they're all not healthy. And it affects everything. I also, as has been mentioned by Elizabeth already, you could see on that map that the impacts of climate change are worst in what World Bank has called the low and lower middle income countries, LMICs. And anybody that's been an emergency responder knows that the most vulnerable people in those communities are the worst affected, the least likely to have access to resources, and the most likely to be devastated by excess heat, drought, any unexpected emergencies like earthquakes, hurricanes, things like that. And, these are the suspects, the usual suspects that we identify as children, elderly, migrants often, people who are in a place where they don't speak the native tongue, the disabled. These are the people that are the most deeply affected by climate change and the least likely to have access to resources. So can you go to the next slide, please? As several people have mentioned, there's several strands of Christian theology that have supported this, faith-based organizations being more and more, ever more involved in working with climate change with their in their programs. And I just want to mention three right now. One of the very oldest strands is the involvement in humanitarian response. So faith-based organizations, or FBOs, have been involved in humanitarian response for many, many years and are usually the first responders in an event. Some of that is because they're local, that they're involved with local churches and programs, and so they're right there when a disaster happens. And there's a real strength within FBOs in humanitarian response. Another aspect is that we know from the scriptures that there's an environmental kind of a justice approach to protect the land, protect the environment, live in harmony with the land and in harmony with other people, and work towards environmental justice. And I think more recently, there's a strand of theology that talks about restorative justice and fairness. And as has been mentioned a couple times already, we know that the people that are suffering the worst effects of climate change are not the ones who caused it. So for them, it's completely unfair. The next slide, please. I just want to highlight some of the things we've learned about the role of health-focused faith-based organizations. Again, they usually are local, and this is such a great strength. They're local organizations. They respond on the local level. And because of this, they really have trust in their communities. So they're a great partner to work with because they're well-known and trusted in their communities. There's also a huge variety of faith-based health organizations, and the statement has a beautiful Venn diagram that talks about all of these, but they're direct service providers quite often. Sometimes they do training, there's support services, supply chain. There's a wide variety of health services that the FBOs focus on. And they're well networked within their own countries. And oftentimes you have donor countries that are involved with these faith-based networks. So the networks work both within the country and across a broader donor landscape. So we also in the statement highlighted what the challenges are for faith-based organizations coming into this conversation of climate change. And it's often the case when local, regional, and national health sector is doing their planning, or emergency managers are doing planning, that faith-based organizations are not included in those discussions. And they're definitely not included often in the resource allocations when money starts flowing into an area that has just experienced a disaster. So besides that challenge of not being part of the planning and the discussion and not receiving some of the resource allocations, it also means that there's a very important unrepresented perspective in those discussions, and that what can be accomplished by and what the needs are of these faith-based organizations is often not there. And in some cases when faith-based organizations are invited to participate, they also have a constrained bandwidth because they're often working on such tight budgets and tight resources. So those are some of the challenges that have, I think, made it difficult up until now for faith-based organizations to be involved in the climate change discussion. Can you move to the next slide, please? So one thing that CCIH became very clear on as they started this effort and developed the consortium is that faith-based organizations really want to be involved in climate change. It's affecting them already. They're already responding to it, and they would love to be a lot more involved in the solutions and and their ability to respond. So here are a couple of things that make that hard for them to be involved. The lack of resources, as I mentioned, exclusion from decision-making. And sometimes, though there are many wonderful climate change tools in health that have been developed in rich countries, these need to be adapted and to take in the perspective of the faith-based organizations. And while I think almost all of the field partners working on the ground are aware that climate change is happening to them right now, there is also a piece of education and awareness that could be increased. And so the people had more understanding of what to expect in their local environments and communities. So that is the kind of the problem as we saw it. And I'm going to turn the time over to Carolyn now, who's going to talk about the exact statement itself and where we go from here. Thanks.
Thanks, Anne. I'm really excited today to share with you a little bit more about the consortium. What are our goals? What are our objectives? And how can you get engaged with the consortium? So first off, how does Faith4CRH, or is the short name for our Faith Consortium for Climate Resilient Health, how are we planning to address the challenges and the topics, the background that Anne just mentioned? Here's our mission, and that is really focused on increasing resilience and coping capacity for FBOs and LMICs, and elevating the voices of communities and generating momentum across health systems. And as Anne mentioned too, when we say health system, we mean the total health system, not just hospitals, health facilities, but church networks, congregations, training institutions, all of the actors that make up that health system. Our vision, where we are envisioning a world where communities have consistent access to quality health care, are prepared for the impacts of climate change, and have appropriate and practical tools they need to adapt. Next slide. So as Faith4CRH, we have come up with a couple of lofty goals, but we really, in creating these, we set our sights on what do we want to be different 5 years from now. There's a lot of actors that are coming up, a lot of different groups in this climate and health space, and we wanted to find our place. How does the faith voice, what role does it have, and what impact can we make together, united? And so how do we think that this Faith4CRH can get us to achieving our vision through these two goals? First, to attract funding for adaptation tools that benefit 50 FBOs in 20 LMICs. So here's just a list of examples of tools. We heard from a few of our speakers, different tools that they've used. I've seen also in the chat some tools that have been used as well. So we're looking at what can be practical, what can be adaptable, and what is appropriate for each and every context. And then the second goal here is small grants to implement 25 climate change related health projects focused on these 3 areas. So it could be something new, something innovative, a proof of concept project. It could be a best practice that is adapted to a different country or a different community. And then this third bullet is really important, that we want to highlight acquiring assets and repairing facilities to increase resilience. We know this is a huge need that is often passed over, or there's not appropriate investment to, for example, get generators. I even saw something in the chat related to the struggle to get actually to maintain power for health facilities and other emergency services. So these are the 3 areas that we're hoping to really invest in for the small grant program. Next slide, please. So looking at those goals and thinking about our objectives, our mission and vision, we wanted to create some way to organize that. And a few of us on the team are really visual people. Coming up with this resilience framework was a helpful way to kind of put each of these things in their own buckets or boxes, if you will. So we have this resilience framework, which we are using as a general framework to respond to a specific vulnerability or a hazard. You have the outer layer that has 4 key actions that are foundational to every activity that you see in the center of the circle. Then the top 2 squares focus on creating conducive context where people understand and leaders are equipped to make changes. And the bottom 2 are more operational, where changes are actually made. So how does this apply to an example that we're all pretty familiar with? Next slide, please. Flooding, the example that Doug gave at the beginning of this launch were really flooding focused. I've seen in the chat also a few examples of flooding in Nigeria from a dysfunctional dam. We've seen a couple of the speakers mentioned issues of flooding. The South Sudan video, you could see all of the flooding there as well. We know this is a huge issue all over the world right now. So we really wanted to use this example for something that a lot of people are experiencing. There's a lot here in the boxes, so I'm not going to cover everything, especially as we're short on time. And for those of you that can stay on, we are planning this launch goes 15 minutes past the hour. So we are having a chance for Q&A. We're getting there very soon. So please stay on if you can. For the first box, we have educating to raise awareness, just focusing on one bullet there, congregation education toolkit. So that would be something to help pastors prepare their congregations for flooding, maybe get some tools in place or communication channels open. The second box, advocating to generate support, local actors engaging in national planning. We heard a few times that that's a big gap, that FBOs, faith actors, aren't involved at the national level in these decision-making conversations, and we really want to advocate to get people there and involved in those conversations. Strengthening coping capacity, things as simple as swimming lessons. It's a simple activity, but it makes a huge impact in reducing drowning during floods. And then implementing structural mitigation, like I said, getting backup generators or elevating medical storage so it doesn't get ruined when floods come. Next slide, please. So as I wrap up here, just want to emphasize a few ways in which Faith4CRH is supporting climate resilient health efforts. We're offering a united voice. We want to pull together all these FBOs and really make a large statement. This action statement is our first step in doing that. Why is it important? What do we want to do? What do we think will actually make an impact for FBOs and faith communities around the globe? Encouraging partnerships with government, with public sector, that's the next 2 bullets, helping them understand the benefit of working with the faith-based actors and really strengthening those partnerships. And then lastly, creating momentum and action for faith-based actors to help cope with climate change. So these are really the core ways in which we're trying to support the climate and health resilience agenda. And I'll post a link in the chat quickly after I finish with ways you can get engaged. Number 1 is join our Google group. It's like a listserv, but people can chat with each other, send resources, send upcoming webinars. What are you doing? What is your FBO experiencing right now? And we'll be sending all the updates about this climate consortium through there as well. So I will send a link to join that in the chat. If you have any issues, I'll also put my email there as well, so you can reach out to me. but we're just really excited to be at the place. CCIH has been taking steps forward in this area for a few years, and to be launching this climate consortium today is really exciting. So with that, I'll turn it back over to Doug, and looking forward to hearing from all of our participants today. Thank you.
Well, thank you, Carolyn, and thank you, Anne, for taking us through the background, the foundation of the paper, and Carolyn especially taking us through what's coming next. And it's an ambitious agenda, the things that we have lined out there. We really are committed to making some tangible, concrete steps. We would love to see every plan and idea explode in terms of scale and impact and reach. But let's be very concrete about some things that we can put out there in front of our members. We know that there will be a lot of people who will pay attention to what we are sharing as well. So I want to underscore the importance of the Google group that Carolyn mentioned. That will be open to everybody as a way to keep up with what we're doing. And I know I think she has just shared the Google group. Carolyn, let's also share again the link just in case people missed it, because that came up, and I want to make sure that one more time that we get that out there. And now is a good time to spend just a couple of minutes. We have just a few minutes for questions. There was one, I think the question that kept coming up through the chat that I saw was, are we going to share the resources? Absolutely. CCIH always, after a webinar, we record the webinar and share the recording, and then we share the links. And if there were documents mentioned, then we'll share those as well. So that, if you're registered for this, you will get that after this session. There was a question about, do you think that FBOs are left out of funding allocations during or after emergencies because they're commonly set up as a parallel health system rather than being well integrated? And Emily, I think, provided a good start to a response. That is a constant struggle that I think we face. Is every health system that we work with is different, and the level of integration is different. But this highlights one reason why we have to be thinking together as a comprehensive health system, not government here and faith-based doing whatever they do, but because these climate change on impact on health and facilities and communities is a shared experience. We have to work across all of them. I want to pause there though and see if our panelists or discussants would like to comment, especially on that one. I would open up for, see, I think we can get everybody on screen. Martina, if you're there, Elizabeth, if you're there, Anne, Carolyn, Godson is here with us. So anybody have a comment on integration of faith-based for the purpose of helping improve this climate resilience, integration of faith-based with national health systems? Any comments on that? Martina, I wonder, you might have a perspective on that in what you work with. Do you have perspective on that to share?
I think one of the issues that we face challenges with is that if it comes particularly to climate finance, is that there's very little available right now. So in terms of being left out, it's because there isn't much going around in terms of finances for climate change. So what's happening right now is at a national level, lots of countries are planning on what path they're taking they're going to take to map their response to climate change and health. People are making vulnerability assessments, something that the WHO has really assigned to really understand what's going on. And in that process, a lot of people are still only at the national level. They haven't come down to the local level to see what our local organizations such as yourself and many people in this consortium are doing and what they're doing. I think the problem is we are still at that idea, as I was saying earlier, about identifying the problem. And people are not there yet, and governments are not always in a place and are prepared to do that. So between the constraints of not much donor funding out there and not much local funding internally. That's where faith-based organizations are being left out, because people are not, they're still stuck at the national level. To think about what's going to happen in the day-to-day lives of people is going to take some time.
Right. Thank you. That's great perspective. Any other views or comments on that integration of faith-based?
Yeah, I would. I think that response was great, and I also appreciate the responses in the chat. I would just add that it's not necessarily only a problem in some settings for faith-based organizations, but for the private sector as a whole. A lot of not just funding, but organization, the public healthcare system is essential and critical, but in many areas, the non-public health service providers also play a critical role. And these can be private for-profit or other like faith-based organizations, other nonprofits. But outside of the public health system, they often do play a very strong and critical role. So not acknowledging that or addressing it really is a gap that needs to be addressed. And I think some countries, some settings do it a bit better than others. But again, there's also, I guess, the flip side to not being fully integrated with a public national health system is that some of those smaller organizations are very well grounded locally in the communities. So that can be a source of strength. But again, yeah, that gap between accessing the funding and being linked into other services such as early warning systems and making sure that health facilities are aware of when early warnings or alerts are being announced, making sure that those linkages are strong really is critical. So I think it's just a very good point to continue to raise.
And Doug, I just wanted to mention that on the emergency management side, you see that divide also, that emergency managers all had their heads together, kind of responding very quickly. And this is usually not related to health. So when there's a health emergency, I don't think there's a good system for that.
Terrific. And there's some other comments that are coming in response to this.
Can I
also
say
in the
something,
chat.
please?
Yeah, please, Godson, please.
Yeah. I think that, thank you very much. I would like to add to what Madam Martina said. I think we need to have a concrete health approach to the climate change today. And also, when we are talking about health approach, we need to incorporate or integrate the reality of trauma for those people who are uprooted and who cannot live in their on their lands. So if we can have a program on trauma, and also I would like to make emphasis on the fact that we don't take much in consideration the local context and how people feel the effect of climate change. We are all the time in theories and in theories. We need to listen to them and to have their stories from what they are living with. I think that faith-based organizations and civil societies are the most indicated organization which can help to understand those who are in this situation.
Wow, powerful words. So thank you. I appreciate the perspective on that. And I could say a lot more about mental health, which is also emerging as a core focus for CCIH. And so naturally, we anticipate there being intersections as you bring up trauma. We just with a few minutes left, I see Dr. Hospitalis, you have a hand up, but I also saw your question about the focus on adaptation, resilience, at the exclusion of mitigation. Maybe you want to say something about that, or maybe you have a different question.
Thanks, Doug. I'm really happy to be in this launch. I feel at home because I'm a physician, a public health doc for 30 years, and I'm a person of faith. I have an editorial in the Christian Journal of Global Health on caring for all of creation. And I see no conflict. Serving God and looking after his creation are entirely compatible, and I am puzzled by Christians who don't get it. Anyway, gosh, there's so much I could say, and would love to continue to be part of this movement. I'm based in Trinidad and Tobago in the Caribbean. I used to be on the Caribbean Disaster Response Team. So the islands, the small island states of the world have about 60 million people, about 1% of the world's population, extremely vulnerable. Right now, we're implementing a USAID-funded project in a part of Trinidad, which has had 154 floods in the last 5 years. So we're in the Southern Caribbean. We don't get as many of the hurricanes, which they do up in the Northern Islands. But we get a lot of the floods, we get the drought, the Sahara dust, and this problem is getting worse and worse, as has been commented upon. And the more vulnerable people get affected, people with existing health problems, low-income groups, migrants. We have a lot of migrants here from Venezuela, and climate's one of the push factors for people leaving Venezuela, although that's not scientifically well documented. I don't want to take too much time. I think people of faith and health professionals are absolutely essential allies. And I have that in 2050, I'll be 95 and I'll give an interview to CNN and the BBC jointly with people of faith about what difference doctors and pastors made to the world tackling this climate change conundrum, because this is the mother of all problems. If we don't respect the creator and respect the interdependence of creation some more, we're doomed, in short. And right now we're on a very, very bad track. If you're a planet doctor, you'd be extremely worried about this planet. On the funding, different point of view, there's actually more funding available than there's good projects. So that's being a bit provocative, but there's more funding available than there's good projects. That's my reading compared to 4 or 5 years ago.
Well, we can be the focal point for seeing where that funding is and direct it to our partners through this. I think if that's something that is a subtext through this that we would like to be able to do. And I know in our closing seconds that we have, you raised the provocative point in your written question earlier about it's understandable to focus on adaptation, but I encourage attention to mitigation because of the health co-benefits of mitigation. I want to see if any of our panelists have a parting thought on that issue, the importance of adaptation, but not at the exclusion of local efforts on mitigation. Anything that you'd want to say about that?
Sure, I could jump in and give a thought before others come in. I think it absolutely is critical to work on both mitigation and adaptation, and that I think we all acknowledge that. I do also acknowledge that different organizations and individuals have, different areas of strength, and that trying to do everything everywhere, it can feel overwhelming on a topic such as this. So identifying where an individual or a group can be most effective is also really important. So to a certain extent, it is necessary to focus to be effective. However, we can also think very comprehensively about our actions and to ensure that we aren't doing any harm, to try to reduce the impact that our good intentions may have, perhaps the unintended consequences. So it is wise to keep, eyes wide open to opportunities for mitigating, for reducing kind of emissions or environmental impact as we are going about our good work.
Thank you. Yeah, appreciate that. Any other final thought on that subject? It was well said.
Just in mentioning, we had a lot of discussion about where the consortium focus would be on adaptation or mitigation, and we landed on the side of adaptation. That's where our strengths lie in our networks right now, but that's not to say we're not working with partners who focus on mitigation. We understand the integration of both to be essential, but our emphasis definitely for this consortium is the adaptation and the coping side of things. Thanks.
Yeah, right. Great. Well, friends, I think we have reached the time. We're just 2 minutes over the time allotted for this. And so I know we could have a vibrant conversation about these things. I want to say a special thank you. And I'm going to say it first, this is gratuitous to say to my own team, Carolyn for helping us get to this point, and for your work in helping to develop the product that's here. I'm going to go out for a moment to our consortium partners: World Relief, World Renew, Chorus International, Kupenda for the Children, the Methodist Church of Togo, Mennonite Central Committee, and Providence Health's Global Programs team. What a great team it is that we have to lead us through this effort. And now back to our three guest panelists, Bishop Godson, Martina, and Elizabeth. Really appreciate your time and your perspectives for us today. Thank you very much. And thank you all of the participants who participated in this. What a terrific event. We're launched.
Congratulations.
Excellent.
Thank you all.
Great. Thanks, everybody.
Bye.
Bye.
Bye. No.